I know selfies are a big thing right now, and I do not take any selfies because I just don't like my nose. I'm having this procedure because I feel like I've had a big nose my whole life, and I just kind of want to get rid of the bump, and I hate how I look in pictures. The main thing that I want done in the procedure is to take the bump out, so from the side it has like a nice curve. Also, I think my nose is really long, so maybe like to shorten it and then just thin out the tip and do a little, maybe bring it out on the sides. Just an overall smaller version of my nose.
She told me the things that were bothering her about her nose, and then I went over the procedure, described how we were going to smooth down her bump by shaving down the bone, taking out the cartilage, and then on her tip we discussed how we're going to make the cartilage smaller in her tip to allow the tip to kind of reduce in size, and how I would also reduce the kind of support of the tip so it would come in a little bit, and also elevating the tip upwards, and the stitching that was needed to kind of hold the tip in place.
When I was researching plastic surgeons, Dr. Kim came up a lot, and it was just a lot of positive reviews and all 5 stars on Yelp. I love Yelp. There was another girl that I worked with on a modeling project, and she had her boobs done, and I said, dude, where'd you go? Yours looks so good and natural. She goes, Dr. Kim. She's like, I did my research for 2 years and I wouldn't go anywhere else. So he was my #1 choice. I can't even picture myself with a different nose, so I'm really excited. Honestly, I'm not as nervous as I thought I would be. Like I said, I've been wanting this since like 3rd or 4th grade, so it's like a long time coming, so it's more like I'm really, really excited. I'm willing to go through the pain or the recovery time because it'll be a lifetime of enjoyment.
Tiffany was a fairly straightforward case. She had a little facial asymmetry, which is very common in most people. So we're trying to get the nose aligned with her face as much as possible while achieving the goals of the procedure. In Tiffany's case, I had to smooth the bump down, and then when I do that, I need to break the bones and then bring the bones in to kind of close the opening that's created from smoothing that bump down. Therefore, afterwards, there's going to be some bruising under the eyes. Usually that lasts about a week, and then by a week, most of the bruising is gone. Casts will be off, stitches will be out. So after a week, most people look pretty normal. Then reduced her tip. After that, I brought the tip in and elevated it. We did it in that order, and then put some stitching in to kind of hold the tip in place, and also to hold it in a reduced size so that it would look smaller in the final outcome.
My results are amazing. I couldn't be happier. Everybody says your nose, like you have like the perfect nose now, and I told everyone at work I was getting it because I was so excited. So everyone at work, when they saw it, they were like, oh my gosh, your nose is just perfect now. So it still looks like me, which I really, really like. Like it fits my face. You can still say, hey, that's Tiffany.
I would say most of the changes happen in the first few weeks. As soon as the cast is off, you'll see a difference, especially if you're just having a bump removed. But the whole healing process takes several weeks to months. It'll take about at least a good solid month for the bones to stabilize. And then as the months go by, you'll keep seeing changes in the tip. At first, the tip will feel very hard, and as it continues to heal, it'll slowly get softer and softer and then keep shrinking a bit.
So I was taking a shower, and I actually just peeled it off right in the shower with like the steaming water. And I got out, obviously I looked in the mirror, and I actually cried when I saw it. I cried, and I was like feeling it with my finger, and to not feel that bump anymore. It's amazing what something so small can do for you. It's been a long time that I wanted it.
The post-op appointment today, examined Tiffany, and I'm just checking to see how everything's healing. She's 3 months post-op, so everything's stable now. The bones are in place. Nothing's really going to shift at this time. And so I'm just checking to see the progress of the tip, see how it's healing, see if there's good symmetry. And in her case, everything seems to be going great. I don't see any scar tissue that's forming in the bump area, and the tip seems to be reducing fine. So far the healing has been great for Tiffany.
This has changed my life. I used to like really contour my nose before and use makeup to make it look smaller, and I really don't have to do that anymore, so that's really nice. The big thing for me is just like you don't even think about it anymore. And before, you always think about it, like how to turn in a picture, how to watch out for the car, it's just like you don't even worry about it anymore. So just that worry-free is what's amazing for me, and the confidence boost. Now that I've met and known and had surgery with Dr. Kim, I wouldn't go anywhere else. I wouldn't even trust anyone else besides Dr. Kim, so I think he's the best.